I also started when I went to ASU to get back into mental health stuff. I was very interested in depression, and I started doing work on the relationship of unwanted childbearing and abortion to depression. I did some papers on this.
Okay. And can you summarize what some of the findings were? What were you finding about unwanted pregnancy and abortion on women's mental health?
Well, one of the things, there are two pieces of why it's really interesting. One, it's interesting because of the policy context. There's a concerted effort it started with Ronald Reagan and when C. Everett Koop was the Surgeon General, where there was an idea that if you make abortion, you can portray abortion as a health risk, then you could have a Surgeon General's report on it and use that as an excuse to regulate it. And then there was a subsequent development of a campaign called the Jericho Plan by David Reardon to, as he says, abortion may be legal, but it won't be accessible because no doctor will dare do it, because we will create a situation where we will establish that abortion causes psychological damage. We will make it a criminal offense to do such damage, and then we will, you can't have malpractice insurance if it's criminal, so therefore no doctor will be able to get malpractice insurance. And they organized lawyers are organized to find women who say they're troubled about abortion so they will sue. It's a very big campaign. And that has kind of evolved also into the fact that Roe versus Wade was this balancing between privacy and costs of unwanted childbearing to society and so on. And they're saying, well, but you didn't have in the equation the psychological damage to the women, therefore we open Roe versus Wade. And the current thing is they're trying to have people, state legislators ban abortion, so that way you can have a challenge go to the Supreme Court about banning abortion, and that way you get the new court, which will be appointed by the Republicans that are currently anti-abortion, to overturn Roe versus Wade. So there's a very long campaign. It's very, very hard. They have American victims of abortion and so on. And so doing research in this context is very, very tricky, because while the position there is we want abortion to have damage because that will help us ban it, a person who would call themselves pro-choice would take the position, it's up to the women. You know, if it causes damage or doesn't cause damage, this is no reason to take away her right. She needs informed consent, and we want to support her. We want to know if it causes damage and why, so that way she will understand what she's risking, because she has to decide what she's going to do. So there's a little different position vis-a-vis the issue from people like me who say, I'm not going to tell somebody to have a child after I started out studying unwanted children and what happens to them. No way. Children born to women denied abortions under the best of circumstances are at a disadvantage. So, and also I have this thing about motherhood being a very private and personal and important, special thing, so people shouldn't be messing with it. So I was interested in, well, are there things that we can do to help women? What do we understand? And if you've had any social psychology training or psychology training at all, you know that anecdotal reports, case studies, a verbal report saying, this is something that bothers me, is a signal that you need to look at something. But very often people don't understand what has made them feel the way they do. You have to go a little beyond that. And particularly when you're trying to say that we're not talking about, I feel guilty, or I feel upset, I'm distressed. We're talking about clinical syndromes requiring mental health intervention that are a public health threat that we need to have legal intervention. That's a different level of threat. Because obviously there are many women who I feel troubled and they wish they hadn't had an abortion, they feel guilty, and they need some support. They do not need a psychotherapist or a psychologist. They don't need a public health therapist. They need to be supported, and so on. So you don't want to make light of this, but on the other hand, it's important to do a very serious evaluation. Well, I did an analysis of the National Longitudinal Study of Youth data, which was interesting because you could get self-esteem before, follow the women, and then see self-esteem after to see what was the most important predictor of self-esteem, which is not a clinical situation, but it's a pretty good indicator of resilience. And the most important predictor was previous self-esteem, education, income, whether or not they had a job. The things that were negative were number of children. If you had more children, you had lower self-esteem at the end of it. Motherhood is pretty hard on women. But the women want to risk it, fine. Abortion didn't have an independent effect, which you control for all these other things.
Right.
Now that doesn't mean that abortion doesn't have an effect or doesn't play into the mix. It's just that if you want to say abortion increases your risk, the evidence wasn't there. Also, it was interesting, number of abortions was correlated with number of unwanted children. And I started looking at unwanted pregnancy rather than the outcome of the pregnancy.
Right.
If you do that, and now I'm talking about other people's work, not mine, you find that it's unwanted pregnancy, and it's multiple unwanted pregnancy when you're young. That's a signal that something's going on. Right. Other work that I've done suggests that it's sexual abuse, histories of sexual abuse and violence, undermine a woman's ability to maybe one way to think about it would be to have bodily integrity, that you can defend yourself. And she gets involved with violent men, and violent men seek these kind of women out. It's not that she's seeking them out. Violent men look for women who are vulnerable to them. And so she has these unwanted pregnancies. Well, whether or not they're terminated by abortion, this woman needs some mental health, serious mental health, serious intervention. And it doesn't, to me, the disturbing thing is to distract people from the fact that the woman needs help by focusing on, well, she's had an abortion. And that's my concern, that there's too much attention to abortion and not enough attention to the fact that women are having these multiple unwanted pregnancies. Any women can have one. And then over time, you might have two, but if you're talking about under 25 years old, if you've had more than one under 25, then you start kind of worrying. And if you've had four under 25, you really, something's going on there.
Right, exactly.
Abortion is not, don't get distracted by abortion in that case. What's going on with this woman? So it's been difficult. I've been very attacked for my work, but